If you're a sleep dentist, I can pretty much guarantee that you are not in control of the number of sleep cases that you are seeing on a monthly or annual basis, or the number of cases that you're closing on a monthly or annual basis. The reason I know that's probably the case is because 99% of the dentists who reach out to us wanting to grow and scale their sleep practice, they are not in control of how many patients they're seeing. What you actually need to overcome this is a predictable system that can attract OSA patients to you. And what that allows you to do, it gives you leverage. I want to explain a little bit about that, but first I want to introduce you to Dr. Cuffy York. Dr. Cuffy York reached out to us in March of 2020. And he didn't have a system in place. In fact, he had a brand new building. He was coming out of general practice, brand new building, new city, hadn't had a single conversation with any local physicians. In his first month, March of 2020, mind you, that's stage 1 shutdown of COVID-19. He did $20,000 in sleep appliances and collected $16,000 of it. So how does someone with a brand new sleep practice who hasn't even spoken to a local physician, how do they come out of the gates in 30 days doing 20 grand? And someone in another situation that's implemented sleep in their practice, they've tried to get their staff on board, they're unable to close 1 case a quarter or 1 case a month. Why is it? What's the difference? The difference is you have to be in control of the number of sleep opportunities. You have to be in control, and you have to be the one attracting those patients to your office. Now, I'm not going to be able to explain this entire system that allows you to predictably attract those sleep patients to the office, but you can click somewhere around this add to access a training that we put together. And what we're going to show you in that, we're going to show you how you can take someone who is CPAP intolerant or might be experiencing the signs and symptoms of obstructive sleep apnea, and they might not even know that it's as a result of OSA, and you can raise that level of awareness through what we call the 5 levels of sleep awareness, and you can take them from a stranger to closing and delivering a sleep appliance in a matter of 30 days. Now, on average, our clients are closing 5 sleep cases within their first 30 days with us. And by the end of 90 days, they're averaging between 7 and 10 sleep appliance cases per month. Now, again, if you don't have that system in place that gives you the leverage to do this, then it's going to be very difficult for you to grow your sleep practice, just like the 99% of dentists who reach out to us who don't yet have that system in place. So go ahead, click the button somewhere around this video and access that training that we've put together for you. And you can literally take what you learn in that video and implement it today and start making that shift in your practice. So go ahead, click the button, watch that training video, and start implementing. We'll see you on the inside. God bless.